Thank you, Professor. Just a wonderful demonstration by Andre. It's amazing. CTO's final therapy based on what? If you look at the data set, it's really going to be a gamish. And I think you really have to look at the data. You have to understand what the data set has shown in the past. So we're going to do a whirlwind tour of all the current data. And you have to go back to the original New England paper by Eric Minar and Mark Schillinger, the Absolute trial, which had the angioplasty versus stenting arm, where they used around 33 to 37% of their patients were occluded. Their outcomes at 12 months are listed here. These are restenotic numbers. So here's the angioplasty versus the stenting arm. So it was a 63% primary patency with the stenting arm using about a 37% CTO group. If you go to the Zilver PTX group, again a 5-centimeter lesion, but about 1 in 4 to 1 in 3 had CTOs, and their primary patency at the year 1 was 77% at 14 months. However, they do have the most seminal of manuscripts out to 5 years now. 66% is their primary patency. So their delta was 10 points over 5 years, with 1 in 4 of those patients having CTOs. The MAJESTIC paper out of the Boston Scientific group were 1 in 2 CTOs on a 7-centimeter lesion length. Their primary patency at 1 year was 96%. Their 2-year data was buried a little bit, but if you look at it, it's down here. It's about 78.2%. So their delta now is nearly 20 points at year 2. Year 3, they do not have a primary patency. They just have a TLR rate of about 85%. The SUPERB trial that we helped lead had about 1 in 4 CTOs, 25%. As you know, this is an interval white stent, which is, I think, where Andre is going with this most recent trial. Our primary patency with a 1 in 4 CTO rate was 86%, and the TLR rate at 3 years was 82%. When it comes to covered stents, I think covered stents have the best data set when it comes to CTO data. The Viper, which was the original trial, which was a fairly flat trial comparing the stent graft, Gore Viabahn stents versus bare metal stents, but it was a 56% over 1 in 2, basically 6 out of 10 chance of having a CTO that was treated here. And the 1-year patency from Vibrant now to Viper, which was a registry, was 74% in that group of 60% CTOs. Probably their best outcomes are on the VIASTAR data. It's a randomized trial, a European randomized trial of Viabahn versus bare metal stent. And really amazingly, 8 out of 10 of these patients had CTOs versus 7 out of 10 in the bare metal stent group. So a remarkably robust group at around 20-centimeter lesion lengths. And if you looked at the overall outcome on primary patency, it was basically a 1 in 5 chance of failure, so 80% primary patency with Viabahn in that CTO group. When you shift everything on its head and start looking at atherectomy devices, the oldest trial, LACI, had 70% of patients with CTOs. This was not a primary patency metric. This was simply a limb salvage metric, and it was 92% at 6 months. When it comes to the excimer laser data, this is the Excite data. I'm not going to belabor the point on lesion length at 20 centimeters, but it was 30 to 36% CTOs in this lesion group. And if you really you got to put it in context. Remember that the primary patency is irrelevant here. It was a coin flip benefit for the laser plus bare balloon as opposed to DCB versus plain old balloon angioplasty in these long in-stent restenoses. But if you looked at the line of identity on a meta-analysis and you looked at the CTO group, short of the diabetics, which are up here, everything is to the left of line of identity. So there was benefit to laser plus balloon angioplasty in these long CTOs. Definitive LE, a trial I helped lead, we had a much smaller group, about 1 in 3 to 1 in 8 CTOs in this patient population in the claudicants. And despite having a relatively good overall primary patency, you can see here that the CTO group that we reported separately was 64% on an 11-centimeter metric versus 66% on a 10-centimeter metric for the CLI group. Orbital atherectomy, or CSI, had 12% CTOs and a 3-centimeter metric, so a very small group which really got their overall approval. But and this was really just an outcome of how patients felt, not really a primary patency outcome. The impact data was 95% in the de novo lesions, but if you look at their lesion length, nearly 10 centimeters, and about 1 in 4 were CTOs, and their primary patency was 78% at 1 year, and now they have 3-year patency at 69%, and a TLR metric, which is not too bad, is a little bit higher than that. But critically, in the registry data, it's long lesions. They have 60% total occlusions, and they have a primary patency in the 90 to 80% range. And then when you did the CTO group principally, you can see 22 centimeter lesions and a 12 centimeter CTO group. Their primary patency was 84%. So these are specific to CTOs. So for CTOs, what to do if you take it in context overall? Unfortunately, with little exception, with very few exceptions, the data on CTOs is buried within the pivotal trials. It's very hard to tease it out. However, what we can conclude is that with this limited data, and even with presumed lesser patency, the overall decline is mitigated within the total primary patency, with primary patencies anywhere from 65 to 85+%. And overall, the choice remains operator's discretion. Clearly, specific outcomes with CTOs may obviate some devices to others, but it is your personal preference as time moves on. Thank you.